Alzheimer's disease affects more women than men, and new research shows one reason could be declining hormones in women. Joining us now to talk about the link between hormone decline and cognitive decline is functional medicine expert Dr. Cathleen Gerenger. Dr. Kathleen, it's always so great to see you.
It's great to see you.
So this is very interesting. I did not realize until I started researching and looking at articles that you sent me before this segment that there is a link between hormones and Alzheimer's disease and cognitive decline.
Absolutely. It starts actually, we're able to detect Alzheimer's as young as in our 30s.
Really?
Yes, yes. It's amazing where we're able to test the APO gene to see if you have the genetic factor for Alzheimer's. And if we test it, don't be scared. What we want to do is that we want to figure out what we can do to be proactive with our health.
So how does hormones play into all of this, especially testosterone? Because a lot of women don't even know that they have testosterone. You always link it to a man, but we have testosterone. You've done my blood work, and you saw a major decline when you looked at it.
Yes, testosterone is so important, especially in women as well. They always focus on men, and I was like, what about women's health? What about our cognitive function? Testosterone does so much because it's kind of like a lock and key type of a messenger where it's able to pass your blood-brain barrier.
Very interesting. So declining hormones, you say, leads to the increase of Alzheimer's, as studies show. So what should we be doing as women?
Definitely get your hormonal check
Okay.
to see where you're at. Not only testosterone, but we look at progesterone, which really helps to keep us nice and calm, and it helps with the mental focus. And then also estrogen. As we start to age and enter menopause, our estrogen level starts to decline.
Okay, so then how is this treated? Because women who've never tried hormone therapy, and I think when hormone therapy first emerged, you know, there was a lot of controversy surrounding it, but it's very different now because it's bioidentical, you know, it's not synthetic. So how does it work? Kind of walk me through it.
So when we talk about hormones, everybody thinks it's like down here, and it's not. Hormone receptor cells are throughout your whole entire body. And with bioidentical hormones, it functions as a lock and key. So that means that your molecular structure of your hormones is the same molecular structure as the bioidentical hormones. And what it does with the cognitive function is that it goes and it really keeps everything nice and calm and keep everything at its balance.
Okay, so it starts with a blood test.
Yes.
And from that point, then what happens? Is it, you know, topicals? Is it medicine? Is it, you know, pellets? How do you determine what to do?
There's, depending on the particular patient, depending on what they're comfortable with, there's pellet therapy where they make a little incision and they put the pellets in there. No surgery needed, no stitching needed, just a steroid strip, and then you're good to go about 3 to 4 months. Another option is injectables. There's injectable testosterone for women where you have to inject yourself at least once or twice a week, depending on your blood chemistry and depending on what your dosing is. And then the other route is a cream that you can apply on your skin. And the absorption of the cream can run about 60%. So it really depends on that individual and that age group.
And if you start a little less aggressive, because the pellets, it is what it is. The pellet's in there, it does its job. If you start with maybe medication and creams, you're going to have to wait for some type of buildup. It's not an immediate turnaround.
Yes. Not only that, you have to step back and give your body a chance to make its own hormones. So that means that remeasure your hormones in about 6 to 3 months to see where your levels is at, and then the doctor can go in there and titrate the dosing according to your body. And when we talk about hormones, it's not just here's the testosterone and you know you feel great. We have to talk about nutrition. We have to talk about diet and lifestyle.
Yeah, which is critical. I mean, it's all a holistic approach.
Yes, and brain-related foods is so important. Like seeds and nuts, like pumpkin seeds, walnuts are really great for the brain function. So if you're able to incorporate nuts and seeds into the diet, that really helps. And fatty fish, like wild-caught salmon, sardines, mackerel. Those are nice high omega-6 essential fatty acid, which is great for our brain function too.
I love it. Dr. Kathleen, it's always such a pleasure seeing you. Thank you so much.
Thank you.
Absolutely. And we're going to post this story on our new website. We hope you check it out.